Hello, everybody. So for our project, we decided to do a drug overdose. My name is Anna Santa Maria, and my partners are Chloe and Carly Campbell. Okay. So for today's agenda, we will be going over the topic. We're going to talk about the description of the course condition within affected individuals, the trends of overdose prevalence, the at-risk populations, our three interventions that address drug overdose, the burdens of the health condition, the interventions, our recommendations, the implementation, and the evaluation. Okay, so for the introduction of drug overdoses, the topic that our group chose to use for the PERIE project is decreasing drug overdose deaths to 18 deaths per 100,000 people. Deaths because of drug overdose is seen in males and females of all races, and drug overdose is developed by misusing medication, and each type of drug has different effects on the body, which ultimately results in a serious health conditions. For example, acetaminophen overdose can result in liver damage, kidney failure, and brain swelling, whereas anti-chlorogenic antidepressant drug overdose can lead to seizures, abnormal heart rhythms, high blood pressure, and a coma. So those are just a few, that was just an example of something that we decided to focus on, of a drug that can cause the body harm, of course. So next is the description of the course of the condition within affected individuals. Our world today has various drugs, illegal and legal, or as we know, prescribed drugs. Our society has the power to misuse them. And some take drugs not knowing what they entail and therefore causing an overdose and sometimes even death. In our world today, children are especially vulnerable to these overdoses, accidental overdoses, because parents may leave alcohol or medicine/drugs out in the children's reach, causing millions of poisonings each year. An example of a drug that has been misused in our society are daily painkillers such as acetaminophen, also known as Tylenol. And the misuse of this drug can cause serious problems to one's body. An overdose on Tylenol is liver damage with symptoms that include loss of appetite, tiredness, nausea, and vomiting and sweating, followed with the next stages of symptoms such as liver failure and abnormal blood tests for liver enzymes. Once the individual is affected, or in this case has overdosed, you will need to look out for certain symptoms to confirm that it is actually an overdose. And in the last stage of an overdose, liver failure advances and the individual becomes jaundiced with yellowing of the skin and white of the eyes. So this is, again, just an example of a drug that we decided to focus for overdoses. Like I said, there's many drugs that people have overdosed from, like our hard drugs such as meth, cocaine, things like that. And then, of course, our like prescribed drugs, I said Tylenol, NyQuil, whatever you can think of. Surely someone has overdosed of these drugs, either by accident or on purpose, unfortunately. Okay, so here I screenshotted a graph from one of the articles that we used, and it is just a graph showing the differences over the years from 1999 to 2017 of the different races. So we have the non-Hispanic white, the non-Hispanic black, Hispanic, and the all races of all origins. So as of 2017, an estimate of approximately 70,000 males and females died due to a drug overdose. This estimate was a 71% increase from the deaths in 2013, which were approximately 43,000 over the years. And over the years, since 1999, it appears that the trend of drug overdose continues to increase. Non-Hispanic white individuals continue to have the highest number in drug overdoses compared to the Hispanic population, who has increased over the years but has increased at very slow rates. So these are just some of the trends that we saw and that were very interesting to us. So that's why we decided to focus on these. And at-risk populations, since 1999, the trend of drug overdose appears to consistently increase, as we saw in the previous slide with the trend that just keep going up. Though drug overdoses occurs in males and females of all races, it seems that non-Hispanic white individuals continue to have the highest number of drug overdose compared to the Hispanic population, as mentioned before. But at very slow rates. Male individuals between the ages of 25 and 34 are at higher risk of death due to drug overdose, and non-Hispanic white individuals have an incidence rate of 53.8 deaths per 100,000. And in the US, males have an incidence rate due to drug overdoses of 29.2 deaths per 100,000, and an incidence rate of death due to drug overdose in all US citizens between the ages of 25 to 24 years old is 5.3. Sorry, that was the ages of 25 to 34 is 5.3 deaths per 100,000. A potential mechanism that may be involved in observed disparities could be the differentiation of the drugs being used. Okay, so here are 3 interventions that have been used. One is the hypothesis of the intervention that was repeated exposure to overdose risk behaviors, and a discussion of opiate overdose was the reboot would result in a reduction of opiate overdose in participants as compared to the treatment as usual. Participants who met the criteria for the study were randomly assigned to receive the reboot treatment, or TAU treatment. The reboot treatment consisted of counselors discussing the information, motivation, behavioral skills model, and behavioral change, personal experience of overdose to determine what the risk factors were that led to an overdose, and discussing various treatments options, and then helping the participant to create a plan for treatment for themselves, of course. And the TAU treatment involved providing a packet of information that consisted of materials on treatment and drug overdoses, as well as offering a follow-up visit or a referral to other services. The next one was the pilot study. So the purpose of this pilot study was to investigate the effectiveness of providing naloxone on release, or NOR, to prisoners in England, and examine the impact on reducing deaths to drug overdose. There were 2 groups in the study. The first group consisted of NOR participants, and these participants received a pack of release that contained a 0.8 milligrams dose of NOR, along with other medical supplies such as safety cover and needle. The second group served as a control group, and the pack these participants received at release did not contain any NOR. The study revealed that being in the NOR group was positively correlated with safer heroin use. However, 8 participants reported using NOR within the first 2 weeks of the release date. Lastly was the strategizing for implementing widespread use of NOR, and the purpose of this study was to assess various strategies for implementing widespread use of NOR in the high-risk population to decrease death due to drug overdose. One intervention strategy discussed was implement pharmacy-based NOR dispensing. This would allow the patients of the patient's caregivers to access NOR without a physician's prescription. The burdens of the health condition is that with all the drugs in our world today, whether illegal or prescribed, our society has the power to misuse them. The morbidity drug overdose depends on which drug was taken, and drug overdose for acetaminophen, anti-chlorogene drugs, antidepressants, and narcotics all have different health effects on the body. And we went a little bit over those, like acetaminophen overdose can result in liver damage, kidney failure, brain swelling, and it just gets worse after they have been used for longer periods of time, or if a lot of these drugs were misused. Finally, overdoses on narcotics or opiates such as heroin, morphine, and codeine result in sleepiness, low blood pressure, and slowed heart rate. It is also common for one's pupils to shrink dramatically in a size when overdosed on opiates. So these are some things to look at also when somebody has overdosed, just in case you want to ensure that they have overdosed. This is something that will verify that they have. If any other drugs are taken at the same time as opiates, the other drugs may counteract the effect of the pupils, which becomes a serious risk to the patient as they might stop breathing. Okay, so our recommendation is, it is recommended that intervention 1 be implemented. This intervention received a score of B, which has a higher than other 2 interventions, higher score. And demonstrated an effective strategy to decrease deaths to drug overdose by incorporating educational and motivational components. Although the study had very few participants as compared to the second intervention, this intervention resulted in a significant decrease in deaths. And although it is believed that this intervention will cost more in comparison to the other 2 interventions because it incorporates both an educational and motivation component. The results from this study suggest that the success rates will outweigh the cost of the intervention. And lastly, this intervention provides a more concrete evidence for success than both interventions 1 and 2, suggesting that the intervention 1 is most likely to end in success. And lastly, the implementation that was used. The target population includes males and females ages 25 and 34. The intervention includes education and motivation strategies and assistance of counselors, access to an OR, and it is implemented in cities with high risk of overdose populations to help those in need or with a problem of overdose. And the evaluations to determine if the target population was reached, a survey could be conducted to gain an understanding of the population taking part in the intervention. If the survey results show that the intervention is being implemented primarily to males and individuals between the ages of 25 and 34, then it will be clear that the intervention has reached the target population. To determine if the effectiveness of the intervention, deaths due to drug overdose will be calculated at interval times. If the number of deaths declines from baseline collection, this will highlight a successful implementation. And this data can be collected by interval visits to city hospitals and funeral homes to collect information on how many individuals actually died from drug overdose. The intervention will be defined as successful if the number of deaths due to drug overdoses decreases. And that is the end of our presentation. I hope you guys enjoy and thank you for watching. And lastly, here is the citations that we used. Thank you.